Okay.
Hello, everyone, and let us introduce you to a fantastic All India rank holder, 165 this year in NEET exam, Dr. Nandini, pass out from JKK Dental College, Tamil Nadu, right?
Yes, sir.
And
Yes, sir.
why this is a special case scenario? Because Nandini is a mother also of a young child, and like she has done with all these studies and everything, which many of us think we don't get time in our daily routines. She has managed very well with a baby in hand and studies on the other hand. Congratulations once
Yes, sir.
again, Dr. Nandini.
Thank you so
Congratulations,
much, sir.
Vishal.
Thank you so much, ma'am.
We have
Thank you
always
so much, ma'am.
guarded mothers as warriors. But you know what? Mothers like you are definitely, the warriors. You all set the example. We can look up and say, okay, if she can do it, I can do it.
Like,
So tell us about
yes,
your
ma'am.
journey, beta. How you started, like after how many years of your passing, and how you actually went through your journey.
Ma'am, I started my preparation after 5 years, ma'am.
Okay.
And I started my preparation when my baby was around 6 months old, ma'am. And initially, it was very difficult for me to balance both my motherhood and my studies and household works, ma'am. It was very difficult. But I used to tell one thing to myself is that whatever happens, I have to do my best. That's the only thing I used to tell to myself, ma'am, so that I may not regret it later. Initially, I took a break during my pregnancy and postpartum period. I felt so much inferior that I simply sit at home, no work, no clinic. In order to get rid of that feeling, I started preparing for NEET. Apart from my baby, I had encountered so much difficulties like hospital admissions and frequent hospital visits for my baby's minor surgery. And even though I had one too, and at the last time, even my husband had surgery for ACL tier 2. So much hospital visits, so much pre-surgical, post-surgical visit too. Even it takes time for hours to recover to post-surgical period. I was cried, even depressed too. But the only one thing I did was I was constant throughout my preparation. Even if I went for hospital, I took my note tab, pen, and I just attended my classes. I was constant throughout my preparation, even though if
Okay.
I am cried, depressed, but I was constant because I need it. I want it. That's
Mm,
the only thing I remember.
that's very tough. How old is your child, Pita? Is it a girl or a boy?
Now 2 year is a girl child, ma'am. Now she is
Okay.
around 2 years old, ma'am.
Okay. And yes, obviously, you had such a hardship, like hospital you go, and I understand going to the hospital, coming back, all the energy is
Yes, ma'am.
actually drained out of you.
Yes,
And
ma'am. Yes,
despite
ma'am.
all that, all
Even
of that. Yes,
Even
Pita.
in the environment in the house also different, ma'am, because pre-surgical and post-surgical visit, and it's quite difficult for me to balance both. But somehow I managed it very well, I think so.
No, yes, you managed very well. And even I want to tell you something, you have totally, inspired me right now. I'm also going through a similar phase where, I have to take my
Yes, ma'am.
mom and to the
Yes,
hospital,
ma'am.
come back. And I was like, how can I do my work? How can I? And now, I know how I can do. So thank you so
Yes,
much.
ma'am.
Kapne, you have inspired me also right now. Right now, even
No,
I
ma'am,
feel
I'm
like
just a
I can
common
do.
woman, ma'am.
No, you are not. There is nothing common about you. You are like
Thank you, ma'am.
very precious and very special. A strength everybody has inside, but only few people, can use it.
Yes, ma'am.
So how you started, Beta? You started with the live classes. How you used to do the preparation?
Yes, ma'am. Initially, no one there was to guide me, ma'am. One day I randomly scrolled Instagram and I saw your profile, ma'am. Then I downloaded free videos and I started watching Sunny sir's OP videos, and I liked it very much, ma'am. Then only I joined your institution, ma'am.
Okay.
Apart from exam preparation, only one thing I just want to tell you, ma'am. I liked your all your teaching very much, ma'am. All subjects, ma'am. I learned a lot in this period than in my college days, and it creates an interest for me to prepare in these exams. Yes, ma'am. And Amit sir, sorry to tell this, sir, and I never liked DM and biochem, sir. But your teaching helps me to create an interest. And ma'am, your courses and in pharmacology and microbiology, it's in a easy and understandable manner. It helps me a lot, ma'am. Thank you so much for your teaching, sir. Apart from my exam, and I enjoyed learning in this period. And
Yes.
one thing I want to tell about Manish sir, he's always available to clear
Always.
our doubts. Sir, always 24/7. Even
Always.
if the questions are repeated, he clears our doubts in in a understandable manner. That's it.
No, and you remember that
Not
question,
one,
what
not
is
one.
rate? What is rate? What is ratio on the group?
Yes, ma'am.
Again,
Yes, ma'am. In the Telegram group, he's always available. Not only him, ma'am. And OP sir, Sumit sir, Sunny sir, and Rahul sir. Rahul sir class was very funny. And Nitish sir, all of them, all of them.
no, that's
It was
very
quite
great.
interesting, and I enjoyed a lot, ma'am.
And that is what is important. When you are in college, you are
Yes,
in so
ma'am.
much of stress. Like when you're
Yes, ma'am.
preparing for MDS, again, stress is there. So, it
Yes,
should be
ma'am.
enjoyable.
You should be. Yes, ma'am.
So, how, Vida, like, what was your strategy? How you used to do it?
Ma'am,
Like,
at
for
first
a
I didn't know
subject.
what to do, how to do, and where to start, where to end. I simply follow our institution instructions, ma'am. First, I completed my notes, and I took a fair copy of my notes, ma'am. I never used others' notes or other materials. I took a
Mm.
fair copy of my notes, ma'am, and I first completed my notes, and then Pulse MCQs, and then our app test series. And then just day by day, I routinely completed that our instructions and instructions, ma'am. That's it, ma'am. And
Okay.
it helped me a lot because unlike others, I didn't have that 4 to 6 hours solid time. Sometimes I have solid time. So if I not completed in a day, I will be completed in a day or a while, ma'am. At live classes, I took a fair copy of my notes, and that notes helped me a lot during my final preparations, ma'am.
Okay. Now you're
I
coming
didn't
out as a very
follow any
strong
other institution.
individual. You are a very strong individual. No, you're coming out as a very strong individual. So did you ever cry during this 1 year? I
Yes,
can't do
ma'am.
it.
Definitely, ma'am. Definitely, definitely, ma'am. But I never had the idea to quit. Even though I am depressed, tried, but I never had the idea to quit. And yes, ma'am. Even if if I leave it in the middle, I would be a bad example for my daughter. That if something troubles you, leave it. I just want it. I have to work hard. That's it, ma'am.
Hmm. Yes, definitely.
So, Dr. Nandini, like you have made it very simple, but I'm sure the day, each and every day passing by would have been a challenge in itself.
Yes,
So,
ma'am.
how,
Definitely. Yes, sir. Definitely, sir.
with everything on, you can say one side, and baby is the priority of a mother, newborn baby, that's like ultimate responsibility.
Hmm.
How you manage, like, were you able to finish off the syllabus on time and the revision modalities? Because a lot of things were there on platter.
Yes, sir. Using this platform, I would like to thank my entire family, sir. Without them, all of these are not possible, sir. Even though my parents and in-laws are aged, having their own medical conditions, they worked hard. They even worked hard for me to achieve my dreams, sir. Without them, all these are not possible, sir. And it is yes, sir. That's it, sir.
How many revisions you were
I'm
able
little
to make
nervous
in
too.
this? That's okay.
Two revisions, sir. Two
Okay.
revisions, sir. First revision, I did everything, sir. Second revision, I did only our notes and after serious revision. And in the third revision, like that, last 2 weeks, I did only my notes, sir.
Okay.
Okay.
Only my
And
notes and past year MCQs.
okay, PYQs.
Past year
Yes.
PYQs.
So, Dr. Nandini, like you studied in your college, you were a good
Yes, sir.
student,
Yes, ma'am.
fairly good student.
Ah,
Okay.
Yes, ma'am.
Okay, then you had a gap. Please tell.
Yes, yes, ma'am. 5 years. Even I missed my UG government seat in 1.5 marks. So I used to tell myself, I just want my government seat.
So now it is done and dusted.
It is done.
Like you have a
Yes,
government seat in Tamil Nadu.
After
yes,
5 years, it
yes,
was almost like starting from zero,
oh, yes, ma'am.
right?
Even I don't know where to start, where to end. I don't know, ma'am. No one was there to guide me to. Just by myself.
Okay,
Really hats off to what you have done, Dr. Nandini.
definitely.
What is your sweet and short message for all the juniors and all the mothers out there who have been like trying to come out of their hive and like start studying again? Because on an average, if I count, we have at least 10 to 15 mothers of newborn or
Yes,
infants or young children who are studying with us almost every year and trying their dream, working hard to achieve their dream of doing MDS in a government college.
Because mother should not be
What
the
should be your
yes.
of the
message? What is
dreams,
your like
Anna.
words of wisdom for them?
Hmm.
Initially, everything was opposing us, but finally, everything favors us because of our hard work. Finally, it's all worth it. If you want something, my message is that if you want something, just go for it. Whatever your circumstances, whatever your health condition, whatever your financial and family condition, whatever, just go for it. And just constant in your preparation. That's the only message I have to tell, sir. Even if I have 5 minutes in a day, I get used to do it. That's the message. That's the message, sir. It was difficult. I know it was difficult. Maybe in words, I have said that we can, but I had encountered lots and lots of difficulties. But at the end, it's all worth it. If you want something, just go for it. That's the
Just go.
message I can.
And you had your baby in hand as the biggest motivation to achieve your dreams.
Yes, sir, definitely, sir.
No, but
Maybe she
what you
might
have,
be proud of me in future too.
yes,
Definitely.
definitely. Definitely. She'll be
One
very
big
proud.
example, you don't have to tell others success stories. Your success story in itself is the biggest example now.
Yes.
Yes, sir. Yes.
Thank
And
you,
thank
Dr.
you so much, sir and ma'am, for your teaching. Thank you so much. I really liked it.
Thank you.
Apart
Thank
from
you.
exam, I really liked and enjoyed your teaching, sir.
Okay.
Thank you.
Thank you so much, Dr.
Thank you.
Nandini. Thank you.